Hi Minneapolis, this is Liz. I work and live in South Minneapolis, and I'm going to talk to you about what it was like to go to the viral screening clinic at Hennepin County Medical Center today. I'm fascinated by this as someone who has studied healthcare and biology, and I applaud the medical staff who got this arranged so quickly, and for something that was put together in less than 24 hours, this worked amazingly well. And it is funny to know what part of the testing took the longest. I'll tell you about that closer to the end, but it's beautiful. So I was exposed to someone who was confirmed to have COVID-19. They contracted it out of state, and I didn't have contact for more than 15 minutes at 3 feet apart, but because I had started exhibiting some cold symptoms, I was still told to go home and call a nurse's hotline, which I did. Now, the way the viral screening clinic is currently set up, you have to have a referral from said nurse's line in order to be screened. You have to meet certain criteria, and they have to schedule you for a time, which is great. If you are just running to a screening clinic and you're not sick with the actual virus and maybe you have a cold, that's a great way to get a secondary infection, just having all those people packed in together. So that's not how it works. So after you're referred, you call in the morning to confirm, and then you go down to the viral clinic. And the way they have it set up is the blue building. There are 4 major buildings to Hennepin County Medical Center. And the blue building is kind of catty-cornered away from the emergency room and the clinic and specialty care center. And the reason they wanted it so close to the emergency room and admitting area is obviously if someone is severely ill, which I have been told that there are some elderly people who can barely make it through 3 words without, having to take a deep breath and wheezing terribly. So obviously they want to get them into a place where they can be given oxygen and fluids as quickly as possible. That's why that was situated where it was. Also, there's a more controlled entrance there. Security guards check names and IDs. You are allowed to have your phone, but you're not allowed to use it to talk. You can text with it after it's been sanitized, but you could not talk on your phone, which I appreciated. They didn't want anything coming in contact with your face and your hands. So there are little X's on the floor as we walked in, and you were given a mask before you walked into the building, or right as you walked into the entranceway. And there were little blue X's spaced a little over 6 feet apart, so that anyone who is standing in a line even is not in close contact either with each other or the security staff or the medical staff. It was very well handled. And the blue X's that were at the tables where information was being taken and people were being checked in were 3 feet away from those tables. So there's still, even with the mask, there's that distance. Very well done. So there were a lot of hand sanitizer stations that you could use along with posters about how to use it. When you use hand sanitizer, similar to the same rules apply with hand washing. It needs to be on the surface of your skin for about 20 seconds, maybe 30 seconds, because hand sanitizer isn't as thorough as hand washing. We were given a sticker. If you had been directly in contact and were to be tested, you got a yellow sticker. If you were accompanying someone who had been exposed or who was being tested, you were given a green sticker so that people were differentiated. Also really great, because while the green stickers do need to be cautious, since they're not exhibiting symptoms or haven't been directly exposed, they don't yet need to be tested according to the guidelines. So there's that. I will put that in my diary along with a few other things in just a moment. So after going through the line and a third set of doors, there was a hallway with the typical waiting room chairs, the clusters of them, and there would be one seat open and then two taped off. So there was still that 6 feet of distance between each person sitting down. A total of 8 people could fit in the hallway. There were a total of 8 rooms available for testing. So there were never more, with the security guard and the nurse in the hallway on staff, there were never more than 10 people in one area at one time. So after waiting for, I think it was about 32 minutes, I was called back. It was very much like triage in the emergency room. You went to one of the little rooms, sat down, and went over a barrage of questions, which, and this is something, if you suspect you have it or you've been experiencing symptoms, you should do, especially if you know that you've been exposed to someone who has it. And that's come up with a timeline and some specifics, such as any symptoms you're having, when they started, how severe they are, the dates that you had contact with the person, if you can remember them, the times. Baby, sorry, she's restless. What your plan of action is, where you work, how many people live in your home, that kind of thing. So have all that information handy. It's just a really good idea. After answering a lot of questions and getting all the information taken, my temperature was taken. It was 99.8, so it was a degree lower than it had been for the past couple of days. 100.8 is a very low-grade fever. Fevers in the medical community are considered to be, in adults, 102 or higher, like high-grade fevers, 102 or higher. And in infants and children, I think it's 101 or higher. I could be wrong about that. I never studied pediatrics intently. Geriatrics fascinated me, but not as much pediatrics. So after taking the temperature and the oxygen, which was at 98, blood pressure was taken, which was obviously going to be elevated because of the situation at hand, but fortunately not to the level of hypertensing. We weren't told not to eat before coming in, although I didn't, just to be safe. We weren't told to abstain from our medications or to take anything special before coming in. So it's still very much business as usual as far as the screening process. There's no big to-do as far as a procedure goes in the office. And with COVID-19, similar to influenza, it's the very same swabbing technique. They do the back of the nose and the back of the throat. Not pleasant at all, but fairly quick. And the entire visit was over and done with. Once you get into the actual office, it was over and done with in, I think, less than 20 minutes. There was a 30-minute wait, and then the actual visit part was over and done with in 20 minutes. But this is what took the longest with every person, and I think this is hilarious. The printers were acting up this morning. Of all the things that could have gone wrong, they had more than enough staff show up. Everything was sectioned off and labeled out perfectly. They had enough hand sanitizer, they had enough masks, they had enough wheelchairs. They were able to keep people from other areas of the hospital mostly directed away. There were 1 or 2 instances where someone did not follow protocol and they had to be turned away by the security. But that was it. Yeah, the one thing that took the longest were the printers. It makes me think of that College Humor animation thing, your printer is a brat. Just that printer sitting in the background. No, I don't want to work. In the middle of a global pandemic even, that printer is still being a jerk. So The likelihood of my having it, even with some of the milder cold symptoms, is relatively low. I'm 36 years old, so my chances of dying from it are very, very low. And because I have been self-quarantining and limiting access to even going shopping before this, just as soon as news that it was in Minnesota started, the chances of me having spread this to anyone else are extremely low. And the test takes about 2 to 3 days to come back. If it comes back positive, then there is a 2-week mandatory quarantine. And then you call the nurse's line, and if you don't have symptoms, they can pretty much clear you to go back to work. I'm not sure what the exact protocol for that is yet, and maybe the center isn't quite sure either, but there is a mandatory 14-day quarantine. If it comes back negative, then the moment my symptoms let up, I can go back to business as usual. So, just using your head, following all of the guidelines, and practicing every one of the 5 things that they've given you. Wash your hands for 20 seconds, use a mask if you have symptoms, don't use one if you don't. Social distance, at least 6 feet between you and casual contact with the next person. Don't touch your face, your eyes, your mouth. I've been touching my glasses, and I did ask a nurse about that, and she said as long as you're cleaning them regularly and sanitizing your hands between other things, and you're not touching the parts that are on your face, you should be okay. But then I'm quarantined right now, so it's not as big of a deal for me. Not that, since I'm quarantined, I've got my hand in my mouth. You should still be smart even when you are quarantined. But it was painless except for the swabbing. It was very well handled, very organized, and for something that was put together in less than 24 hours, it was really incredible. It was amazing to see how well the medical staff have just taken charge and come up with these plans of action. I need to go and make sure my cat is not going insane, because she wants to play right now. Everyone in Minneapolis, be well, practice the 5, take a deep breath, just not around another person. Kidding. And I think we're going to be okay. We just need to be smart about this. We do need to be careful, but we really need to be smart and not throw ourselves into a panic. Have a good evening.